Nursing knowledge base. So under nursing knowledge base, there are subtopics. These are the factors influencing bowel elimination, common bowel elimination, and bowel diversion. So under the factors influencing bowel elimination is the age, diet, fluid intake, physical activities, psychological factors, personal habit, the position during defecation, pain, pregnancy, surgery, anesthesia, the medication, and the diagnostic test. And under the common bowel elimination is the constipation, impaction, diarrhea, incontinence, the flatulence, and the hemorrhoids. And under the bowel diversion is the ostomies and other procedure. Now, let us discuss what are the factors influencing bowel elimination. So age. So in infant, they have smaller stomach capacity, thus less secretion of the digestive enzyme and more rapid intestinal peristalsis, and peristalsis moved food through your digestive system. And the ability to control the defecation do not occur until 2 to 3 years of age. So adolescents experience rapid growth and increased metabolic rate. Thus, there is also rapid growth of the large intestine and increased secretion of the gastric acid to digest food fibers and act as a bactericide against swallowed organisms. Now, older adults may have decreased chewing ability, thus, chewed food is not digested properly or easily. So, peristalsis declines and the esophageal emptying slows or nagiging mahina na yung pag-digest ng pagkain kasi hindi na rin sila active. So, next is our diet. So, regular food intake helps maintain a regular pattern of peristalsis in the colon. Fiber in the diet provides the bulk in the fecal materials. Bulk forming foods such as whole grains, fresh fruits, and vegetables help remove the fat and waste product from the body with more efficiency. So, the food we intake can be a big influence in our bowel elimination. Now, personal habits. Personal elimination habit influences bowel function. Such most people benefit from. Now, personal habit. Personal elimination habit influences our bowel function. How? Most people benefit from being able to use their own toilet facilities at times that is most effective and convenient for them. A busy work schedule sometimes prevents the individual from responding appropriately to the urge to defecate, disrupting regular habit and causing possible alterations such as constipation, and individuals needs to recognize the best time for elimination. So, may mga other people that pinipigilan nila yung pagpupo nila, so that can cause magiging constipated na sila kasi nagiging habit na nila yung di mo na ako pupupo, or pinipigilan nila yung pagpupo, nagiging habit na nila. So, they become constipated na kasi hindi na sila nakakapupo. So, isa din yun sa nakaka-influence ng bowel elimination natin or pagpupo natin. Now, the diagnostic test. So, diagnostic examination involving visualization of the gastrointestinal structures often requires a prescribed bowel preparation. For example, the laxative or enemas to ensure that the bowel is empty. So, usually patient cannot eat or drink several hours before examination. Such so so diagnostic test. So, diagnostic examination involving visualization of the gastrointestinal structure often requires a prescribed bowel preparation, such example laxatives and enemas to ensure that the bowel is empty. So, following the diagnostic procedure, changes in elimination such as increased gas or loose stool often occurs until patient resume a normal eating pattern. So, before the diagnostic examination kasi, a patient cannot have or cannot eat or drink any food or liquid. So, that can alter our bowel elimination or yung pag-poop or pag-secrete ng waste product natin. Next is a fluid intake. So, an inadequate fluid intake or disturbance resulting in fluid loss, such as vomiting, affects the characteristic of feces. fluid, liquefied intestinal content by absorbing into the fiber from the diet and creating a larger, softer stool mass. Next is physical activity. Physical activity promotes peristalsis, whereas immobilization depresses it. Encourage early ambulation as illness began to resolve or as soon as possible after surgery to promote maintenance of peristaltis and normal elimination. Maintaining tone of skeletal muscles or maintaining tone of skeletal muscle used during defecation is important. Weakened abdominal and pelvic floor muscle impairs the ability to increase intra-abdominal pressure and control the external sphincter. As a result, As a result of these changes in the abdominal and pelvic floor muscle, there is an increased risk of constipation. Next is psychological factors. Prolonged emotional stress impairs the function of almost all the body system. During emotional stress, the digestive process is accelerated and peristalsis is increased. Side effect of peristaltis includes diarrhea and gaseous distension. Next is position during defecation. So squatting is a normal position during defecation. Modern toilets facilities this Modern toilets facilitate this posture, allowing a person to lean forward, exert intra-abdominal pressure, and contract the gluteal muscle. Next is the pain. So normally, the act of defecation is painless. However, a number of conditions such as hemorrhoids, rectal surgery, anal fissures, which are painful linear splits in the perineal area, and abdominal surgery result in discomfort. In these instances, the patient often suppresses the urge to defecate to avoid pain, contributing to the development of constipation. Next is pregnancy. As pregnancy advances, the size of fetus increases and pressure is exerted on the rectum. A temporary obstruction created by the fetus impairs the passage of the feces. So, a pregnant woman's frequent straining during defecation or delivering may result in formation of hemorrhoids. Surgery and anesthesia. General anesthetic agents used during surgery cause temporary cessation or peristalsis. A patient who receives a local or regional anesthetic is less at risk for elimination alteration because this type of anesthesia generally affects bowel inactivity minimally or not at all. Medication. Many medications prescribed for acute and chronic condition have secondary effect on a patient's bowel elimination pattern. Some medication are used primarily for their action on the bowel and will promote defecation, such as laxative or the cathartics or control diarrhea. If laxative are needed for regular evacuation of the rectum, a fiber laxative is the first type used. If this is not sufficient to relieve constipation, the next one tried should be an osmotic laxative. Patients need to avoid regular use of stimulant laxative because the intestine often becomes dependent on it. So if too much laxative intake, this will cause your intestine to be dependent on the laxative you are taking. Next is the common bowel elimination. So in this common bowel elimination, we have 6. Constipation. This is a symptom, not a disease, with many possible. So next is our bowel elimination. So in the bowel elimination, we have 6. So the constipation is a symptoms, not a disease, with many possible causes, such as improper diet, reduced fluid intake, lack of exercise, and some medication. Sign of constipation includes infrequent bowel movement and hard, dry stool. Passage of a dry, hard stool often causes rectal pain. So as we have discussed, or as I have mentioned earlier, the factors influencing the bowel elimination, this can be seen in if you are constipated. So that's the symptoms, or that's the cause of a constipation. Next is the impaction. Fecal infection results when a patient has unrelieved constipation and is unable to expel the hardened feces retained in the rectum. Diarrhea, this is an increased number of stool and the passage of liquid and formed feces. It is associated with disorder affecting digestion, absorption, and secretion in the gastrointestinal tract. Next is the incontinence. Fecal incontinence is the inability to control passage of feces and gas from the anus. Next, the flatulence. This is a common cause of abdominal fullness, pain, and cramping. Flatulence causes abdominal distension and severe, sharp pain, and the intestinal motility is reduced. Next is the hemorrhoids. This is a detailed engorged vein in the lining of the rectum. Next is the bowel diversion. So certain disease or surgical alteration make the normal passage of intestinal contents throughout the small and large intestine difficult or inadvisable. Ileostomy or colostomy is a surgery to create an opening called a stomata. The opening creates a passage from the large intestine to the outside of your body. So, ostomies is a surgery to create an opening in the stomata from an area inside the body to the outside. It treats certain disease of the digestive or the urinary system. Ileonal pouch an ileonal pouch anastomosis. Ileonal pouch anastomosis is a surgical procedure that is used to restore gastrointestinal continuity after surgical removal of the colon and rectum. Now let us move on to common causes of constipation. So, common causes of constipation are irregular bowel habits and ignoring the urge to defecate, chronic illness such as the Parkinson's disease, multiple sclerosis, uh, the rheumatoid arthritis, chronic bowel disease, depression, and eating disorder, low fiber diet, high in animal fats such as meat and carbohydrates, and low fluid intake, distress, illness of a family member, death of a loved one or divorce, physical inactivity, medication, especially used of the opiates, and change in life or routine such as pregnancy, aging, and travel, neurological condition that blocks the nerve impulse to the colon, such as stroke, spinal cord injury, and tumor, and lastly is the chronic bowel dysfunction, so in the colonic inertia or irritable is example is the colonic inertia or the irritable bowel.